condition with the vessels itself is the coronary artery disease. Okay, so the coronary arteries, these are the vessels that supply the heart itself with oxygen, right? So your whole body needs arteries to bring oxygen and blood to them. Well, your heart also requires oxygen and blood. So the coronary arteries are what supply the heart muscle itself. So with coronary artery disease, what's happening is that those arteries are becoming narrower, usually because there's plaque buildup, like cholesterol, fat blocking the arteries, or they're becoming hardened. Okay, so they become stiff, and when they're stiff, they're not able to dilate. Remember, we talked about vasoconstriction and vasodilation, where the vessels get smaller and they get wider, right? So they're able to kind of stretch. So if they're hardened, they can't do that. So they can't stretch and open up wider. So like I said, etiology, the cause of this is atherosclerosis. That's what we call the buildup of the plaque, right? So like the cholesterol, we might also hear it called lipids, lipid deposits. Those are all related to that. And then the hardening is the arteriosclerosis. Hyperlipidemia, who wants to take a shot at what that word means?
Hyper means fast.
Too much, yeah.
Right.
What are lipids?
Blood.
Fat, and emia. What's emia mean? Emia is in the blood, right? Like heme, anything with like the em in there. So hyperlipidemia is too much fat in the bloodstream. Okay, so due to diet, eating too much, greasy fat items, whatever, cholesterol, all that fat circulating in the bloodstream, it tends to stick to the walls of the arteries and build up there. Okay, so that's what happens with that. That's why it's called the high cholesterol. Risk factors for coronary artery disease: smoking. Smoking makes your arteries harden up, so that nicotine actually, over time, damages the arteries, so they become less able to dilate. So people that smoked a while, they have really bad circulation because their vessels aren't able to expand and contract like they normally could. They become real stiff. Obesity, this is just related to lifestyle, what they're eating, so typically a lot of like I said, fatty foods and high cholesterol foods. Hypertension, sedentary lifestyle, that just means you're sitting around a lot, not doing a lot of exercise. Why exercise matters is because it works out your cardiovascular system, right? So when you're exercising, it puts stress on your heart, so your vessels have to learn how to expand, and contract regularly, so it works them out. So it's kind of like if you don't use it, you lose it type of thing. They lose the ability to vasodilate and vasoconstrict if they're not required to do that very often. And then also just high stress as well. So those are the risk factors for that. Symptoms wise, generally people don't have symptoms. They don't realize it's happening. You can't feel plaque buildup in your body, right? You can't sense that. So generally you don't have symptoms until it's gotten to the point where it's bad, right? Then you start having symptoms. Then you'll start having things like crushing chest pain, right? And the reason why you're having that crushing chest pain is because the blood isn't getting to the heart, so the heart starts to be in distress and starts to die, right? So that's where the crushing heart pain comes from. Sometimes it radiates to that arm. People, when they're having a heart attack, they clutch their arm, in the movies, So the weakness and the vomiting is just related to that lack of oxygen, right? So you just feel ill when you don't have the oxygen flow there. How you can diagnose this is you can do an EKG, which looks at the electrical activity of the heart, right? If the heart is not receiving enough oxygen because of the blocked arteries, then the heart's not going to be functioning properly, right? So it could mess up the electrical system. A stress test. Who remembers what a stress test is? What's the patient doing? Right, so they put you on a treadmill and they have you slowly increase how fast it goes, and they're measuring how your heart responds, right? They're looking at your oxygen levels, they're taking your blood pressure. And then the cardiac angiography, what's that one?
Heart cath.
What are they doing?
Running a catheter.
Yeah, they put that little camera catheter up into through your vessels, and they can see if there's areas of blockages, right? All right, so treatment-wise, there are a lot of specific cholesterol meds. Anybody know of any? Very, very common. People take them all the time.
What is that?
Statins, exactly.
Okay.
You'll see commercials for like Crestor and Lipitor on TV. So that's the brand name, you know, the generic name end in statin. So like atorvastatin, rosuvastatin, all those help get rid of, you know, some of that cholesterol buildup. Then they also will give vasodilators as well to help widen up those vessels, right? Because the wider the vessels are, the more blood and oxygen can get through, right? Does that make sense?
Yeah.
They may also do an angioplasty. Remember what that is? What's an angioplasty?
Ain't that where they go in and walk
Like why and then.
Yeah, so they take the same kind of idea with the catheter, they insert it, and then when it gets to the blockage, it like pops out, right, and like creates like an opening. It's kind of like a stent, right? So they open
Right.
to create like a little bridge for the blood to get through. And then a cabbage, what does this stand for?
Coronary.
Yep.
Artery
Bypass graft. So that's like, again, if there's a traffic jam on the highway, some people will take an exit ramp, you know, to go around it and then merge in later. It's the same idea. They add a blood vessel so it bypasses around the blockage, so that way they can just not worry about. Sometimes there's blockages that they can't operate on them for whatever reason.
I don't want to do an angioplasty. Because it's too.
Yeah, there's some that they can't do, whether it's too hard or it would like they're at risk for rupture, like if the vessel is really weak, or I'm not a surgeon, so like I don't know why they would choose one or the other, but there's just possible reasons where they might be safer to do a bypass or it might be safer to do an angioplasty. So they just have multiple options to address the issue. Then prognosis, this is a chronic disease, right? This isn't something acute, like an illness that you get over. It doesn't resolve itself, like you have to like fix it with surgery and be on medication generally for a while. Any questions about coronary artery disease? This is kind of a picture of what that might look like. So you can see how this isn't that bad, whereas this is like really blocked.
So if you're on the statins, or if they give you the statins to help open it.
Well, the statins don't help open it. Those are the vasodilators. The statins help reduce the cholesterol. So this stuff here is the cholesterol buildup, the plaque, right? So it doesn't necessarily like fix it all the way. It just helps prevent like it getting
more.
worse. Yeah.
It helps prevent more, but it don't clean out what's already there.
Yeah.
Okay.
Does that make sense? And here's that picture of that cabbage again. I don't really. So like here's a picture of like the blocked passage here. They can take vessels and just go around it, so they don't have to worry about having to go through that. It's like a little exit ramp. Okay, then we have shock. You've probably heard of people saying this, oh, they're going into shock, right? Like on television and things like that. So what's happening with shock is it's basically like kind of a collapse of the circulatory system. So what they mean by that is like, usually this happens in response to some kind of traumatic event. So extreme blood loss is a cause of shock. Like you lose a lot of blood, you can go into shock. People that have extreme like anaphylactic shock. You ever heard of anaphylactic shock? It's people have like an extreme allergic reaction. That's why they give people EpiPens, right, to prevent this from happening. Lots of different things can cause shock, right? So it's not just one thing. That's why the etiology has like multiple different things. So some kind of traumatic event or other situations happening here. Basically what happens is all your vessels and arteries all of a sudden just like rapidly vasodilate, which generally, is good to get blood flow, but like vasodilates so much that your blood pressure just drops so low that like the pump is barely being effective at this point, right? You want to have a happy medium of pressure, right? You don't want the pressure to be too high with hypertension, but you also don't want the pressure to be so low, right? Because if the pressure is so low, like if you barely turn on a hose and the water's just barely trickling out, like you're not getting significant water flow, right? So it's like if your blood pressure is so low, you're not getting any blood flow through your body. Does that make sense? Mm-hmm. So basically, that's what they mean by cardiovascular collapse. Like it's just you're so vasodilated that like there's no blood flow actually being pumped out. So this is going to make people very cold and clammy, their heart rate is going to be like very weak and rapid. their blood pressure is going to have a very dramatic drop. So that's what this is. The blood pressure drops, and we call that hypotension, right? Because hypertension is too much. So hypotension is not enough, right? Feeling dizzy. What's diaphoresis?
Diaphoresis.
What's that word? Medical term.
Sweating.
Sweating. So it's like, that breaking out in a cold sweat type thing. People tend to feel like this sense of impending doom. And again, like I said, this can happen from hemorrhage, which is where you have a lot of rapid blood loss, which is obviously you take away all the fluid, you're not gonna have good blood pressure. Anaphylaxis, extreme allergic reaction. Sepsis. Anybody know what sepsis is?
Yes, my grandfather has that, and he went in septic shock.
Yeah, so there's lots of different types of shock. There's hemorrhagic shock, which is like losing blood, anaphylactic shock, septic shock. Sepsis is where you have a very bad case of bacteria in the bloodstream. You should not have bacteria in your bloodstream. That's bad, right? Your bloodstream should be sterile in the sense that it should be bacteria-free, right? But that's usually not a good thing when that happens. So yeah, does that kind of make sense? Like my description of what's happening with shock?
So, say if you get a cut, so doesn't that bacteria get in your blood?
It's not necessarily in your bloodstream, it's just like in your tissues, right? So things can go from your tissues and spread into your bloodstream, right? If it doesn't get treated, right? Any wound has a potential for sepsis, but generally people that are healthy, their immune system fights it off well, and it doesn't, necessarily go.
Right, because we're constantly producing red and white blood cells.
Yeah. Generally, people that if you clean it, and it's if it's deep enough, you might get an antibiotic. People don't generally get shock from a cut or something, but people become more prone to sepsis. Like when you get older, your immune system is just weaker. So also little kids are prone to sepsis just because their immune systems aren't functioning as like an adult's is. So yeah. Let's see. Okay, so diagnosis-wise, a lot of it is just you can kind of look at how they're acting and look at their blood pressure dropping, and you can be like, okay, they're going into shock, especially like their blood pressure is rapidly dropping. We're talking like blood pressures like 80/40, right? I've seen people with blood pressures really low like that. So that's what vital signs means. Like they look at their heart rate, they look at their respiratory rate, they look at their blood pressure. Those are all the vital signs. Temperature.
Okay, so I have a question now. Okay, because his nurse came the day before, and she took his vitals, and he was fine. But then the very next day, my brother found him slumped over, unresponsive.
Yeah, it can come quick.
I was gonna say,
Yeah,
my grandmother, before she passed, she would be perfectly fine, and then not even an hour later, emergency room.
Yeah, it's not like you have the vital signs and it lasts for several days. Like it
Right.
can happen pretty quick, So that's why when they're having the symptoms, you check the vital signs, and people can also do something like a blood culture. That would be checking for sepsis. Like they take the blood and see if there's any bacteria in there growing.
Right.
Yeah,
That's
but that takes some time, to do
Right.
that.
That's what they do. After
Yeah.
he was admitted
Mhm.
to make sure the antibiotics are working.
Yeah. So generally, if someone is going into shock, what they're going to do is give them fluids right away, like IV, like fluids to help give pressure back into the system, right?
Okay.
Because the issue again is that they have very little pressure, right? So they usually give fluids regardless of what kind of shock it is. If it's
Okay.
septic shock, they're going to obviously give you antibiotics really fast in IV to get rid of that infection in the bloodstream, right?
So why does it affect your neural? Why do they?
It's just lack of oxygen, right? Because the oxygen is carried on the bloodstream, and so if you have very little blood being circulated, you're going to have very little oxygen getting to the brain, to the heart, to everywhere. Right? Does that make sense?
Yes. Okay.
So blood flow is everything, because blood flow is oxygen, and
Right.
organs can't function without oxygen.
Right. Okay.
Treatment-wise, so again, like I kind of said, this is going to be an aggressive emergency intervention, so they're going to be, 911, hospital, ICU, all that. If it's caused by excessive bleeding, hemorrhaging, then you're going to stop the bleeding, give blood, right? If it's sepsis, you're going to give IV antibiotics. So you're going to treat the underlying issue, right? But first things first, you want to fix the pressure problem, so giving them fluids, maybe blood if applicable, oxygen, just because the lack of blood flow means less oxygen, so you're going to give them some extra. So this is an acute problem, right? This isn't like a lifestyle disease. Like this will, if you treat it, it will resolve, right? It's like a temporary thing. However, if it's not addressed properly, it can be potentially fatal, right? People have died from hemorrhagic shock. People have died from septic shock, anaphylactic shock. So it's just one of those more dangerous acute conditions. Does that make sense?
Yeah.
Any other questions about shock? Okay. All right, so a thrombus, you might also see emboli, kind of same difference. This is just referring to a clot of some kind blocking a blood vessel. So a thrombus, generally speaking, is going to be a blood clot, but it also could be, you know how we had that plaque lined up in the arteries from the cholesterol? Sometimes those can dislodge, or they can break off, and now you have a big fat globule floating around in the circulatory system, which that's bad, right? Because that can block an artery. So like I said, it usually is blood clots, but it could be fat, it could be bacterial clumps, like in sepsis. Sometimes the bacteria can like bunch up together and make a clot. It can be an air bubble. Anybody ever heard about like people getting air in their IV and then dying? So that can be they call that an air emboli. So an air embolus. The most common is people get blood clots in their legs, generally from being inactive. So I don't know if anybody's had anybody in the hospital or ever been in the hospital, but they stress a lot, activity, especially like pumping your legs. They even have those little devices that squeeze your legs.
Yeah.
You know what I'm talking about? Anybody ever seen those? Like these little things you wrap around your legs and they squeeze.
Squeeze it.
We call those SCDs, or sequential compression devices. So every now and then they just kind of squeeze to get some blood flowing. Because what happens, like I said before, with a rushing river, usually the water stays pretty clean, but like a lake that's just sitting there, you start to develop like gross kind of film and like a layer of scum on the top of the water. Same kind of deal when your blood isn't moving, it just kind of sits there, starts to congeal, starts to like get kind of nasty, so that's why like movement is really important.
Well,
So
when my grandmother, she had MS.
Okay.
So she was paralyzed from the waist down.
Okay.
But she was still able to transfer over and everything.
Mhm.
That's before she had her stroke. But she had to do those little leg things.
The leg squeezers?
Yes. She would get in her little recliner every day
Yeah.
and put it on for I don't know how long.
Yeah.
She would
That's
put
good.
it on, and we're just like, it's so weird. It's just so
Yeah.
weird.
Well, it's important because, like I said, if you can't, especially if you're paralyzed, you
Yeah.
can't move. So like that blood is just going to be sitting there.
Yes.
And when it just sits there, it tends to form clots.
Mhm.
So like the most common is a clot forming in the leg, and that's just because of gravity, right? Like the blood is just like when you stand up, the blood's just going to sit there. Does that make sense? So that's just typically where blood clots tend to come from. Those are the most common. They call those DVTs, or deep vein thromboses. There's just deep veins within the legs that they just get clogged up. So how do you know you have a DVT or a clot forming? Generally, there's going to be severe pain in that area. So, with like the one in the calf muscle, for example, people get like really bad calf pain. That area might turn really red, warm to the touch. I think I have a picture. Yeah, so this one, you can kind of see how this one is kind of swollen and red compared to this one. And so obviously this person's in the hospital, so like DVTs are very common in the hospital, people just laying in bed all the time. So diagnostic wise, people, complaining of calf pain and having those symptoms, but remember the blood test, the D-dimer?
Yes.
What does that measure?
That tells them if they got a clot.
Yeah, exactly. So that's what that lab does. They can also do a venous ultrasound. So an ultrasound, just like when they do when you're pregnant, they can use an ultrasound kind of like on your veins, and they can see if there's a clot there. So if you do have a clot, well, hold on. To prevent clots, there's blood thinners. You might have heard of heparin or Lovenox.
Yes.
Those are called these are like anticoagulants and whatnot. If you already have a clot, an anticoagulant, they're still going to put you on them, but that's not going to deal with the issue of you having one, right? There's preventative, and then there's like dealing with a current clot. So a thrombolytic, who remembers what thrombolytic means?
It breaks up It breaks up the.
The thrombus, right?
Right.
So a thrombus, we get the word thrombus from thrombocyte, which is what is the medical term for platelets, right? So platelets are called thrombocytes. So whenever you see thrombus or thrombolytic, like they're talking about a clot, like of platelets, right? So, and then lytic means to break down. So you're breaking down the thrombus, which is the clot. So that's just the difference there. And we'll talk about more medications at the end. A prognosis, again, these are acute conditions. They just kind of happen. They usually resolve. However, if the clot, starts moving and like gets moved to the brain, the heart, or the lungs, it can be fatal if they don't address it, right? Because going to the brain causes stroke, right? Going to the lungs is a pulmonary embolism. Going to the heart is a what?
Heart attack.
And what do we call that?
A myocardial infarction.
Exactly. So those three places we don't want a blood clot to go to, right? You kind of need your heart, brains, and your lungs. Any questions about that one? Make sense?
Yeah, it's a lot with the circulatory system.
I know. That's why it took 2 weeks to do it.
Yeah.
In other textbooks I've seen, they split it up. Like they'll do the heart in one chapter and then like the vessels and stuff in another, but they just put it all in one. So.
Yeah, because it's different systems within
Yeah.
that.
I know. That's why I broke it up into 2 weeks.
This reminds me of that old show, 1,000 Ways to Die.
1,000 ways to die. Yeah, the more you learn about how many things can go wrong in the body, the more of a miracle it is that we're all just like alive every day. That nothing has just gone wrong.
Right.
Sitting
Yeah.
and gaming for like over 24 hours. And these shows are ridiculous, but he was sitting for like over 24 hours, and when he like won the game, he like stood up to celebrate and then died.
From a clot.
I'm like, okay.
Yep. That's probably from a blood clot. So this is what that looks like in the deep vein in the legs here,
Oh my God.
so they can see that.
Oh my God.
All right, another way to die, aneurysm. So an aneurysm is where a artery or vessel or whatever, it becomes very, very weak and starts to kind of like, have you ever seen a garden hose where it starts to like bulge? You ever talking about? And there's like a bulge that happens in the hose because the hose is getting weak, and then like sometimes it can just pop and now your hose is broken. You ever see that? I garden a lot, so like I have to constantly get new hoses just because the pressure, like the constant pressure in the hose like tends to make them warp. So that's what's happening with aneurysms. It's like people with constant high blood pressure, the pressure causes the vessels to start weakening, having a little bulge, and then they can, if they get bad enough, they can rupture, and then you can bleed out internally, right? That's no bueno. We don't like that. So here's a picture, for example. You see this little bulge here? Those can, like, I've seen those like on my, on my hose, like from the constant pressure of the water.
Yes.
So this is what that looks like, and then this part can obviously rupture if it gets bad enough. So risk factors for this. Coronary artery disease often can cause this, right? The atherosclerosis, because it's blocked and it weakens the artery.
Right.
Trauma, obviously, so if you get hit really hard in the head, you can rupture a vessel in your head, for example. Smoking, again, because smoking, that nicotine causes the vessels to harden, right? And if they're hardened, they're not elastic, right? So if you try to stretch something that's not elastic, it's gonna break. Ever seen a rubber band that's dry rotted?
Yes, that's how I was thinking of dry rotting.
Exactly. You try to stretch that rubber band, and instead of stretching, it just breaks. So that's the same thing. That's what nicotine does to your blood vessels.
Oh my God.
Yep.
They need this. They need to put a billboard with that on, because everybody in Cleveland smoke.
Yeah. And then high blood pressure, again, just like that constant pressure can cause the vessels to get weak, just like that garden hose. Symptoms, I mean, obviously most people don't realize it's happening until it's happening, so they could experience some pain or throbbing over that site. The most common kind of aneurysm is usually in the abdomen, it's the AAA right here, not a AAA battery, but that's just what we call it, a AAA. It's an abdominal aortic aneurysm. So that the aorta that comes out of your heart, it goes all the way down through your abdomen. And so I don't know why, but that happens to be a very common site of aneurysm is in the abdomen there. An abdominal aortic aneurysm there. And an aneurysm is another potential cause of shock, right? So we talked about blood loss being a cause of shock. Well, if someone has an aneurysm and they're bleeding out inside, they're going to have symptoms of shock, right? Let's see. You can sometimes also see, like, you won't see it on yourself unless you have this, but like you can sometimes see people who are having an aneurysm that hasn't ruptured yet, but it's like that bulge. You can see like a pulsing kind of throbbing in their abdomen. That's that aorta, like the bulge of that, and they can see it pulsating with their pulse. So obviously if you see that, you need to get that fixed. So what they typically do is, well, this doesn't really help see it a little, but they kind of create like a space for the blood to flow through instead of bunching up in the bulge. So now the blood is flowing through this instead, and this is going to be reinforced so that the pressure won't rupture that. Does that make sense? They can also sometimes, there's lots of different ways to repair an organ, an aneurysm, but you don't need to know about that for this class. Diagnostic wise, they'll just do imaging. You know, they can do a CT scan, ultrasound, and MRI to see that aneurysm. Especially if like one's in the brain, they're not gonna be able to see it like you would be on the abdomen, right? Because the skull is in the way. So like you wouldn't be able to see that pulsatingness, you know, with you can in the abdomen. A bruit on auscultation. Auscultation means hearing. So like usually they talk about like with listening with your stethoscope, that's auscultation. And a bruit is just kind of a swishing sound, kind of like whoosh, 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 whoosh. Like it's the sound of the turbulence of the blood flow. So like if someone had an aneurysm in their abdomen, they can like put the stethoscope on it and you'll just hear like a whoosh, whoosh, whoosh. It's the sound of the turbulent blood flow like going through that bulge. So that's how they can tell. But yeah, imaging is going to be the biggest one. They can find out exactly where it is, how big it is, that sort of thing. And then treatment, the only option is surgical repair. Like you can't, there's no medicine that's going to fix that, right? Like you've got to fix that piece of the vessel. Yeah, and if you don't, it can rupture and that can lead to shock or death. So it's kind of not really optional. You really need to get that fixed. Any questions about that one, aneurysm?
So when they say people die from aneurysm, I thought that means it goes to their head.
You can have aneurysm in your brain. Anywhere you have a vessel, you can have an aneurysm. They're just commonly in the abdomen for whatever reason. But you can definitely have a ruptured blood vessel in the brain. That's what you call a hemorrhagic stroke, right? Because there's two types of stroke. There's hemorrhagic stroke, which is where it like the blood vessel pops and you bleed out, or you can have the clot to the brain. Either way, you're not getting blood flow and oxygen to the brain.
That's what I
Yeah.
Okay.
my boyfriend, he had the
Hemorrhagic stroke?
hemorrhagic stroke.
Yeah. The stroke just means that that part of your brain has died from lack of blood flow and oxygen. So there's two ways for that to happen. Either you can be bleeding internally so the blood isn't like getting to where it's supposed to be, or you can have a clot and the blood can't get there. So hemorrhagic stroke, or they call it ischemic stroke,
Yeah.
which is the blood clot.
So can you look at it like, just remembrance, like your brain having a heart attack?
Kind of, yeah, that's literally what it is.
Okay.
If you have lack of blood flow to the heart, it's a heart attack. Lack of blood flow to the brain, it's a stroke. It's the same thing.
Right, okay. Okay.
Yep, you got it.
And whatever side it messes with, it happens, it affects the
The opposite
side.
side.
Mm-hmm.
So he had his on the left, and so
On
his
right, yeah.
dominant, so his whole right side's paralyzed.
All right, next one. This one is not life-threatening, so you're welcome. This is not one way to die. This is varicose veins. You've probably seen these on like old ladies. They look like this.
Ooh, that's a bad one.
You've seen them. So this is a less bad.
Yeah. Ooh, because that look like her veins. Ooh,
Yeah.
Ooh.
It's very common in the elderly, especially little ladies. Basically what's happening here is that the veins are swollen and twisted in the lower legs. This happens just because as we get older, things start falling apart, okay? So that's just,
Like
yeah.
a car.
yeah.
Parts.
It's just, people are like, why does this happen? It's like age.
Right.
People are more at risk for this if they do prolonged sitting or standing. And again, that's just because the lack of like constant movement is weakening the valves over time. So you actually have valves in your veins that help push the blood back up. Right? Because think about it, the arteries are delivering the blood that's oxygenated to the body, but it gets to go down, right? But that's easy, it goes with gravity. But in order for the blood to come back up the body, it has to go against gravity, and that's difficult to push something uphill, right? So they have, in your veins, there's a series of valves, kind of like in your heart, you have the valves. So like it squeezes the blood up segmentally, right? But if your valves start being defective, then they don't push up as well, so the blood just keeps falling down to the point where it gets like this, right? So that's just like that's just blood pooling in the legs and stretching out the veins. Does that make sense? So prolonged standing, so a lot of times nurses get these real bad because they're constantly on their feet, you know? So like wearing compression socks can help because it creates artificial pressure in the legs to help squeeze it back up. You ever seen those compression stockings?
Yeah.
I used to wear those a lot when I worked in the hospital. Yeah. Yeah, I used to wear them all the time because it actually helped your legs like hurt less too. Because like when you're constantly on your feet, your legs start to really hurt. It's just putting stress on your, on your legs all day. So yeah, definitely compression socks help for sure. Symptoms, just your legs just feel tired and hurt. This is just because they're just being overused. Leg cramps, swollen ankles. The veins will start feeling more stiff and hard. Diagnostic wise, you just kind of see it. There's not like a special test. You don't need a special test to diagnose that. You just see it, right? Yeah, there's not really much you can do except for treat the symptoms. They do have like some special new like laser surgeries that people can do that are coming out, but mostly it's just going to be treating like the symptoms. So compression stockings, hot and cold treatments with water. Elevating the legs helps because when you elevate your legs, it helps the gravity, right? Because when your legs are down, it has to go up against gravity. So yeah, there are some laser surgeries that they can do. This is a chronic condition, right? This isn't something that's gonna go away in a couple weeks. It's just it's chronic and progressive. Like it gets worse with time.
So, for someone who sits all day, will it eventually be that?
It's not guaranteed. Like
Right.
You're not guaranteed to get this if you sit all day, but it's a risk factor.
Right.
Right? So like even people that smoke, you're not guaranteed to get lung cancer, but it's just a
Right.
risk factor.
Right.
So
Okay. So you can do the compression socks.
yeah, compressions definitely help for sure. Because it helps squeeze those veins so that the blood can't pool in them and stretch them out, right? Because it's like squeezing them and forcing it to move on.
A lot of people at Amazon have varicose veins.
Yeah.
That
Really?
spider veins.
Yeah. That's what like
Especially
these.
ones that's been there for a while. They came in with no issues, and where we are on our feet up to 12 hours on concrete like nurses.
Yeah.
That's
Yeah.
your downfall right up
Mhm.
there.
For sure.
I've started having the spider veins.
Yeah.
Like where my knees are. Yeah.
Start wearing some compressions,
That's
girl.
what I said.
That's why I'm thinking about. I
Yeah.
sit all day. I
I
work
said
sit
that.
all
You said
day.
that. I was like,
You also can get they sell like on Amazon those sequential compression devices that they have in the hospital, but they're just
Yeah.
like they're not hospital grade. But you
Right.
get like I like to bring them like on long airplane trips
Yeah.
because my legs start to hurt real bad. You just strap them on and you do that and it helps. I get really bad restless legs in airplanes where I have to sit for a very long time. I hate it. So you can get those or like one of those little foot pedal things if you're like
Yeah.
sitting all day, like especially if you guys work from home doing coding.
Yeah.
They have these little like things where you can like press like this, kind of like a mini elliptical, but it's just pedals, so you can get something like that.
I saw those. Oh yeah, that's a good idea.
Because sitting all day, like it's nice to work from home, but you just want to think about that. So
I was gonna get a raised desk with a walk pad.
you can do that too.
'Cause my legs-
Whatever works. There's lots of options. So
So is that the same thing, spider veins?
spider veins is more like this. It's just like a varicose is just when it looks like this. Spider veins is just kind of like an initial warning sign.
Yeah.
Right.
At the beginning stages.
Yeah.
Oh,
They call them little spider because they look like little
Yeah.
spider legs.
Because where my knees are on the inside here,
Yeah.
that's her ankles looks like
Yeah.
the start of my knees. But it's from being on our feet, because we
Yeah.
stand in one spot majority of the time.
Yeah.
We're not walking around.
Yeah.
Yeah.
All right, so now we're at Raynaud's. Have you ever heard of Raynaud's? I actually had a couple students previously who actually had this condition, so it was kind of interesting.
I've heard of it, but I did not.
It's basically, let me show you a picture. See her hand? So like what's happening here is that the blood vessels are constricting
Yeah.
here, so there's no blood flow getting to it, so that's why it's turning white. Okay, so typically this is triggered by cold. Sometimes people get triggered by other stuff like stress,
Yeah.
but it's just a random kind of condition where the vessels are spasming in response to usually things like cold. It could be caffeine, it could be stress, but cold is the most common one. So you know your blood vessels are supposed to dilate and constrict, but like they're just like inappropriately doing that in response to a trigger. So they're just like clenching up and like blocking the blood flow for some reason. So
That's
yeah, it's kind of like when you sit. You know how like you sit on your foot and like it starts going numb because it's blocking the blood flow.
Yeah.
It's kind of the same idea, but they're doing it by themselves without you sitting on it. I sit on my foot all the time and it like goes numb and then it's like I hate that. Like
Yeah.
it's kind of the same idea. So symptoms wise, it's like I said, it's generally caused by cold. You get that discoloration that you can see there. Blanching, that's what that means. The blanching is when it turns white. And that comes from French, like blanc means white in French, so that's where we get the word blanching from. It also can turn blue or red as well. Diagnostic wise, people just kind of can tell you, hey, when I get really cold, my hands do this. And there's not like a special test, you can just see it, right? That's just like the history, numbness and paleness in the area. Typically, they're just gonna put your hands in something warm. So like those hand warmers that you can carry around in your pockets, or running them under hot water. Smoking is a big one as well. People that smoke tend to have worse rain-ons, again, because the nicotine makes those vessels harder, right? So they're gonna be naturally more narrow. Avoiding cold when possible, and then vasodilators. So vasodilators, when you're having an attack like this, you can take a vasodilator and it will help force those vessels to open back up again instead of constricting. This is a chronic thing. It's just a weird condition. It's kind of like people with autoimmune diseases. They just kind of have it and you have to deal with it. It's kind of like that. It's not technically an autoimmune disease because it's not involving the immune system. There's no like antibodies attacking you. It's just the vessels are just spasming. And it's intermittent. It just kind of happens sometimes. It does not like you have it every day. So it's just kind of.
Okay, that's what I was gonna say. Cause I was like, if that cause it's only in the fingers and hands, right?
It can happen in the feet too. Like typically the peripheral, because that's where the blood flow is the weakest. Like in your hands and toes.
Oh.
But yeah, hands are very common.
Cause it kind of looks like vitiligo, like almost.
Yeah, I just think it's not the skin that's
Yeah.
changing, it's the lack of blood flow to the area.
Right.
Yeah.
So that's why I was like, how would you know?
It goes
what I'm
away.
saying?
Like vitiligo doesn't go away, it's like always like that. Your skin
Okay.
just permanently changed color.
Right.
But this is like, when you warm your hands back up, they go back to normal. So-
Okay.
So you can see like this one's turning white, this one's turning blue, this one's turning red. People's like, they just change its color from the lack of blood flow. So
Wow.
yeah.
That's scary.
Do they also get the tingly sensation?
Yeah, you get that numbness and tingly. Not everybody does, but that's a potential symptom, yeah.
Yeah.
Well, that's all the vessel issues. So everything we talked about had to do directly with an artery or vein. Okay, so now we're gonna jump into issues with the blood itself. So like the components of blood. If you've done your homework already, there was a video about the blood components. I'm not sure if that was this one's homework or the next one's homework.
I was gonna say, man, that new today.
It might have been because I put it on ahead of time.
Oh.
It might be for this coming week. But there's a video I have about like the different components of the blood itself to help kind of make more sense.
Okay.
So the first one is different types of anemias. Okay, so anemia, again, what does emia mean?
Like.
Emia, you're thinking of emia, like
In the blood.
Blood.
in the blood. And so an is like the opposite of, right? So like normal and abnormal. So this is blood and lack of blood. So anemia just means not a lack of blood, essentially. So a reduction of specifically the red blood cells or hemoglobin. Hemoglobin is a part of a red blood cell, okay? So don't get that confused. Like there's a cake and then there's flour, right? Flour is used to make a cake, right? Hemoglobin is used to make red blood cells. So if you don't have enough hemoglobin in your body, Well, guess what? You don't have enough red blood cells because you can't make a cake without flour, right? So does that make sense?
Okay.
So etiology, like I said, hemoglobin, that's HGB. Hemoglobin is a building block of red blood cells, and the job of red blood cells is to transport oxygen, right? That's literally what they do. They just carry oxygen to the different parts of the body. So when we have lack of red blood cells, people are going to have lack of oxygen. So that's the issue with people with anemia, is that it isn't so much just that they're having less iron, red blood cells, is that they're not going to have enough oxygen to deliver to the body. Okay, so symptoms-wise, this is why they have fatigue and difficulty breathing, right? They feel like they need to breathe more to get more oxygen, right? They feel like they have to. Normally, people breathe like 12 to 20 times a minute, but when you have anemia, typically your respiratory rate's going to be higher because you're trying to get more oxygen. Headaches from the lack of oxygen. For some reason, lack of appetite. Syncope. What's syncope? Passing out. Pallor is just, you're pale, kind of like, paler than normal. Numbness and tingling, and especially like in the fingers and toes from the lack of oxygen. How they diagnose this is they're going to do just some blood tests, right? Obviously, they're going to look at your blood and see what's going on. So CBC is that complete blood count, right? So they're just going to see how many red blood cells you have, right? Because there's a range of normal. People with anemia have a lower than normal amount of red blood cells. They can also test your hemoglobin. That can be low as well. They have special ways of looking at the red blood cells themselves, like under a microscope, and they can see, because there's different types of anemia. Okay, we don't need to go over all the different types in this class, but different types of anemia are caused by different things. So they can actually look at the red blood cells and see some of them are smaller than normal. That tells them what's going on. Some of them are a different color. Like sometimes the red blood cells are like a more pink instead of red. Sometimes they're different size. Sometimes they're like really, really big. That tells them like what kind of anemia they're having. Okay, so you don't need to know all that. Just know that that's possible. The different types that are pretty common. There's folic acid induced anemia. So people they don't have enough folic acid in their diet. A lot of these are just related to building up the red blood cells, right? So there's iron. You've probably heard of people with low iron. Iron, hemoglobin, folic acid, all of that stuff is needed to create the red blood cells. Okay, so you don't know why someone's anemic. It might be because they don't have enough iron. It could be because they don't have enough folic acid, right? It could also be B12. If you remember all the way back in the immune system chapter, we talked about pernicious anemia. Remember pernicious anemia?
Yeah.
And that was a result of low B12.
Right.
So you have to figure out what's the cause of their anemia to be able to treat it, right? Because if it's an iron deficiency and you're just giving them B12, that's not going to help
That's
anything.
not gonna help.
So
right.
it's like, what do we not have? Do we not have eggs? Do we not have flour? Do we not have sugar? What do we need to make this cake? Okay, so like giving more flour when you don't have eggs isn't going to fix it. Does that make sense? Anybody heard of sickle cell anemia?
Yeah.
What do we know about sickle cell?
It's ain't that's like autoimmune?
It's not autoimmune, but it's where they look like this, like little sickle shapes. So the red blood cells should be like this round donut shape. People with sickle cell anemia, for whatever reason, they're making red blood cells that have this sickle shape instead of the round shape. The problem with that is they tend to get stuck and clump up more frequently than people with normal shaped red blood cells. And so during a sickle cell crisis, people's have a clump of these sickle shaped red blood cells getting trapped, and then it causes severe pain because it's basically like having an embolus. Right, like it's causing a blockage, and so it hurts really bad in that area because there's no blood flow going. So sickle cell anemia is it can be serious. People have an attack because it's like having a stroke or heart attack kind of thing. It's blocking off those vessels. Does that make sense?
Yeah.
Because they're just shaped wrong. This shape makes it easy for them to slip through and go through, but this shape makes them easier to clump up.
Yeah, like they're not pushed, they're not.
Yeah, they get clogged up easier. So that's sickle cell anemia. That's obviously not something you can fix with diet, because that's not the problem, right? So sickle cell is a chronic condition that you just have to deal with. That you're just going to have sickle cell anemia forever. Whereas the other ones, like folic acid or iron or B12, if you fix that problem, then it's fixed, right?
Yeah, because I was anemic for a long time, low iron, and I was getting, the iron infusions.
Yeah.
I'm better now.
Yeah, some people can get anemia temporarily, like when they have really, really bad periods.
Yes.
They lose a lot of blood, so they
Yeah.
can be anemic for like that portion of of their cycle, but then it gets back to normal. Does that make sense? So
Yeah.
there's different causes of anemia, different types of anemia. I just want you to know what anemia is, right? It's the lack of red blood cells, and that can be from multiple different problems, right? Does that make sense?
Right, yeah.
Okay, so again, treatment-wise is going to be directed at the cause. So if it's a deficiency, fix the deficiency. Pain meds are going to be a very big thing for people with sickle cell, just because it hurts really bad. Because think about people with that DVT in their legs, and that leg hurts, but that's just one clot in one spot. When you have sickle cell anemia, you typically have these micro clots everywhere, and it's just like your whole body, right? So it's everywhere hurts so bad. So they actually give them like really strong pain meds, like morphine, because like your whole body is like in excruciating pain. So it's really bad. They definitely put them on oxygen. They might even get blood transfusions. So sickle cell is the one kind that's more of a chronic condition that you're born with this. Okay, so like no, it's not a deficiency problem. Does that make sense?
So how do they, okay, I know you said the blood transfusions, but does that help it like flow?
It helps give them normal shaped red blood cells, you know?
Oh, okay,
Yeah.
okay.
But again, that's only going to be temporary. Like, it
Right,
doesn't last forever.
right,
So.
cause they still could have another.
Yeah, because you're constantly creating more red blood cells, so like they're going to be creating more that are shaped wrong, right? But if people have a really bad case, they can get blood transfusions for
Is
that.
there a way to keep them from making them like that?
That's just, you're just born that way.
Okay,
Yeah.
Wow.
I didn't know if there was like a med that would,
Uh-uh.
down the line, would keep them from
No.
That
shaking
shit,
like that.
That's so
Yeah.
weird how
Yeah.
it's like that.
Yeah, and it's not like they have this problem all the time. Like they'll have these attacks, like periodically. It's not like they're
Right.
constantly in an attack, right? Like because it doesn't always clump up and clot. It's just
Right.
sometimes. It's just
Right.
like it gets triggered by something. I don't know. Okay, so that was anemias. Now we have leukemias. Okay, anybody know what the root word leuc is from?
Why?
White blood cells, right? Those are called leukocytes.
Yeah.
Okay, so leukemia is talking about in the bloodstream with the white blood cells. Okay, so this is there's different types of leukemias as well, but typically this is cancerous. Okay, so what's happening here is that the white blood cells they develop some kind of cancer within themselves, and so your body tries to create more of them to compensate, but they're spitting them out before they're fully mature. All right, so they're trying to crank up the production of white blood cells to compensate for the fact that they have a cancer, but they're not ready yet. They're like immature juvenile white blood cells that don't function as well. Does that make sense? It's like you're sending out, someone who's not trained to go do a job that they haven't been trained for, kind of thing. So symptoms-wise, people tend to have really bad bone pain, and that's because these, the white blood cells are made from the bone marrow. You ever heard of like a bone marrow transplant? People get, bone marrow transplants when they have like the white blood cell cancers, leukemias, for example. They start losing weight loss is always a symptom of any type of cancer. This is not like unique to this type. Weight loss is always every type of cancer.
Okay.
And I don't know why that is. It's one of those things. Increased bleeding and bruising, swollen lymph nodes. That just goes along with leukemia. Diagnosis-wise, they're going to do blood studies. So they're going to do, like we talked about with the anemia, they can look at your red blood cells, see how many there are, see the size and shape and all of that. They do exactly the same thing for this, right? They're going to look at the size and shape and number of your white blood cells and see what's going on. Yeah, that's pretty much it. They can do a bone marrow biopsy, which sounds awful because you have to like insert a needle into the bone and pull some out. No, thank you. Treatment-wise, since it is cancer, you guys have talked about in Miss Kelly's class with neoplasms, chemo, radiation, bone marrow transplant. I mean, that's kind of the options, right? Prognosis-wise, it depends on how old they are, how far along they are, like what stage you catch it in. There's also multiple different types of leukemia. So some leukemias are more treatable than other types, right? So it's kind of hard to give a specific prognosis because it really just depends. Any questions about that one? Here's kind of a picture. So like this is what normal blood looks like, and then you can see in leukemia there's like a bunch more like white blood cells because they're trying to overcompensate by creating more, but they're not able to do their job well because they're immature. So that's really all. The problem also here is that because there's so many, the abnormal cells start to crowd out the healthy blood cells, which is bad, right? Does that make sense? Okay. All right. Let's see, how much more do we have to go? We might finish early. You guys want to take a break now?
Yeah.
I'm gonna take like a 10-minute break. Come back at 2 because it's 1:50.
Yeah.
Anybody getting sleepy?
Yeah.
Yeah, we'll take a break now because we don't have too much left. Wow, that's kind of a dumb moment. I was looking for my phone, I couldn't find it. I'm like, oh right, it's being used to record. I'm sorry everyone's sick and not here, but it's kind of nice having a smaller
Yeah.
class. You guys can talk more.
Well, it helps too by going slower.
Yeah, I wish I could go slower like this all the time, but I wouldn't ever get through anything.
True.
That's why I record it so you guys can watch it back slower. You know, because I know I do have to go kind of quick to not run out of time. Only having one class period per chapter is,
Kind of hard.
yeah, it's hard on y'all. It's hard on me too. So. Did you have a question?
Did I?
Oh, you looked at me. I thought maybe you had.
Oh, no.
Oh, it's sitting. I want those chairs that's in there that brought in here. These having no cushion is not fun. Especially when you ain't got no cushion back there. Before long, my butt's going down, and I'm like, good lord. I feel so bad for, Savannah Guthrie.
Who's that?
Remember the TV, she's the talk show, used to be on
Her
Today's
mother?
Show, and her mama disappeared, and they can't figure out where she's at, like, nobody knows.
Well, that you know.
I think
her-
it's the daughter, her daughter and husband,
Yeah.
son-in-law.
Her second daughter, not
Yes.
the one that's on the TV show,
No,
the
the other.
second daughter, her husband is under investigation.
I remember they're wrong.
Yeah, well, I told her, I said, okay, well, I said, it's better that you're going slow, but she's like, oh, I wish I could go slow all the time, but there's so much. Which I get, but.
Sometimes she be overwhelmed. I started feeling scared. I think she was in glasses when I was I'm not a psychologist.
Oh, Rick just happened to Edmund Cullen.
How do you let your puppy just run around? This was in McMahon. Is this your puppy? I had to run in the road and grab this baby up before it got hit by a car. 507 West Madison Avenue. Look how freaking cute. It's so tiny.
They might not know. They might be at work.
True.
And somebody could let them out, you know.
Sorry about that.
You know how,
Bless its heart. I'll take it
it'd
home.
be so
with me.
tiny
Put it in a
and
few
cute.
minutes.
Mhm.
Well, you can't get out. Oh, what's worse, having them on a chain or just let them run loose?
I know, yeah.
All right, you ready to knock this out?
Mhm.
All right, then we've got hemophilia next. Heme, we know it has to do with the blood because it has heme in there. This is a genetic disorder. Okay, so this is going to be a chronic thing that someone has. This isn't an acute illness that goes away like you're born with it. Okay, so it's hereditary and it's a bleeding disorder. Okay, so, and again, this goes a little bit more in depth than you guys need to know, so I'm not going to get into it, but there's more than just platelets that are involved with clotting. Okay, there's lots of other things that go involved into it. So Nothing is wrong with their platelets. Their platelets are fine. What they don't have is something called factor 8, or the little Roman numerals there, V111, factor 8. And the V is 5 and the 3, 1, so it's like 5 plus 3 is 8. Anyways, factor 8 is it's a mechanism in the clotting. Okay, so that's way over what you guys need to know about. Okay, so basically, if you just see like a factor 8 deficiency, just has to do with bleeding. Okay, there's lots of things you have to have, kind of like with the flour, eggs, and sugar to make a cake to have a red blood cell. You have to have lots of different things in order to clot properly. Okay, and platelets are one of them. Obviously, if you don't have platelets, you can't clot. But if you also don't have factor 8, you can't clot as well either. So, you know the X and Y chromosomes. You know the XX and XY. So this disorder is carried on the X chromosome. So they call it X-linked genetic disorder. And males typically have it more often, just because they only have one X, right? So they have an X and a Y. That's what males are, XY. And women are XX, right? So we have two X's. So in order for a woman to have this disorder, both of their X's have to have this disorder, right? Because you get one chromosome from one parent and one chromosome from the other, right? And so if someone donates an X and another parent donates another X, then you're a female. If one parent donates an X and another parent donates a Y, then you're a male, okay? So the reason why males tend to have it more often is because they only need one X to have this disorder, right? Because they only XY. Whereas females are two X's, and it's just more unlikely for both of those X's to have this disorder. Does that make sense? So women can have it, it's just not as common. Both parents would have to have hemophilia and pass it on for a girl child to have it. Does that make sense?
Yeah, because she got two
Yeah.
X's, right?
So that's why X-linked, anything that's X-linked is going to be more common in males, because they only need one. Okay. Symptoms-wise, they're going to have problems with bleeding and clotting. Okay. So when they get cut, they're going to bleed longer and more than the average person. Okay. They bruise more easily, right? Because again, with the bleeding issue, hematomas, those are just like big bruises, okay, like under the skin, like you ever got like a really bad fall and you have like this really hard like blood kind of, but it's like hard and like raised, that's like a hematoma. They tend to have really bad nosebleeds just because they're not able to clot well, okay? So generally that's not a good thing. We don't want to bleed out, right? So how they diagnose this is they're going to do lots of different blood tests, and they're going to notice that the platelets are normal, right? So it's nothing to do with the platelets, it's the factor 8, okay? So the only real treatment they can do is they can do blood transfusions, and they can also give synthetic factor 8, so just like a medication that mimics the factor 8, kind of like people that have hypothyroid, their thyroid doesn't make the thyroid hormone, so you take synthetic thyroid pills to mimic those hormones that they don't have. It's the same kind of idea. They just take factor 8 supplements, okay? But yeah, this is a chronic disorder. You're not going to get rid of it because you were born with it. Does that make sense? All right, that's it for the blood problems that we're going to talk about in this class anyway. And now we're on to the lymph. Okay, so the lymph, let me see if I have a picture. So the lymphatic system kind of looks like the cardiovascular system, right? It looks like veins, right? It's these vessels that go all through your body, but instead of carrying blood, they carry lymphatic fluid. Okay, so it's same idea, but different. So lymphedema, we know edema means swelling, right? But the swelling is related to the lymph fluid instead of like being related to blood. So what's happening here is that there's a bunch of lymphatic fluid collecting in the extremities, usually the legs, again, because that's where gravity will pull it down to, right? This generally happens when a lymphatic vessel gets blocked or obstructed. Okay, so it's just not able to flow properly. Same idea with like a clot, right? It blocks the flow. Symptoms-wise, they're going to be very swollen and distended. And I'll show you a picture here. Diagnostic-wise, I mean, you can look at it and be like, oh, well, you have a lot of swelling there, and then they can do imaging, and the imaging will show where that blockage is, okay? Treatment wise is you want to get rid of that swelling, so compressions, like compression socks. People who have lymphedema pretty much wear compressions all the time. Elevating their legs. Diuretics. What do diuretics do?
Make you pee.
Yep, so they make you pee out all your extra fluid, right? People on diuretics have to pee all the time. Like people might call it their water pill. That's kind of like a common thing that people call it. And then this is a chronic problem. It's not like something you're gonna get over quickly. Let me just see if I have a picture of it. Yeah, here's a picture of lymphedema. So you can see like it progressively can get worse. See the swelling?
Yeah, number 4. I know people like that.
Yeah. Yep, that's lymphedema.
So because you think they just be fat, you know what
Yeah,
I'm saying?
no.
But they top body be small.
Yep, but it's not related to fat at all. It's just fluid.
So that it's no, okay. I'm gonna finish writing my notes because I'm about to have 30 questions.
It's okay. And then you can see like when you press on it, it's like pressing on a water bag. You know, see how it's bulging like that?
Uh-huh.
So, did you have a question you wanted to ask about it?
I'm gonna go back to the, okay, yeah, where it say what you can do treatment. That's what I was gonna say, well, what they do besides, because what if that's not helping?
They can't do much else. That's why it's chronic and progressive.
Yeah. But you can't die, like.
No,
die.
it's not life-threatening. It's just uncomfortable and obnoxious to have that, you know.
Cause some people have it.
Yeah.
Like.
Yeah, it can get real bad.
Yes.
Now, it could become life-threatening if, like, you know, it gets so bad that you start getting, like, wounds in your skin because, like, it's just so swollen, like, it's just stretching, you know what I'm saying? Like, people are more likely to get wounds, and then if those wounds get infected, they can cause sepsis and things like that, but those are, like, it's not directly related to lymphedema, it's like, it's just gotten so bad now I have all these other problems, too. So, you're more likely to get sores and things when you have skin like this, you know, because your circulation just isn't good, the pressure on the skin constantly, you know, so, does that make sense?
Yeah.
So would they do any surgery on that, like any cosmetic surgery, or would they not recommend that?
I imagine there's probably some kind of, like, you know, because it's caused by blocked lymphatic vessels, right? So I imagine there's probably some kind of, like, bypass, like with the heart they can do, but with the lymph. I don't know. I don't know everything about this stuff.
Those vibration plates, that's what that's supposed to do.
Oh,
Yeah.
Robert.
Yeah, that helps get everything moving.
Yeah.
But I imagine there's probably some type of surgery they can do to cut out damaged lymph vessels or bypass. I don't know, but I do know that people have their like breasts removed, like mastectomies.
Yeah.
People tend to have lymphatic issues because they have to take out the lymph node as well.
Yes.
Right, so they tend to have like issues with drainage.
Yeah.
So I don't know. I'm not a lymph surgeon,
Right.
but I would imagine there's probably something they can do.
So is that like
Can you go back?
happens over time, or is that
Yeah, right.
like
Yeah, I mean it takes time to get this bad. It's
Okay.
not like it happens overnight.
okay.
And that's why they have like the stage
Yeah.
here, you know, like
Oh, okay.
this is the same person, you know.
There's no way that can, if that
Yeah, no, it
happens
doesn't. You don't wake up one day and it's
yeah,
like that.
I'd be panicking. I'd be like, oh my gosh.
No, yeah, that's what I'm saying. It happens over time, but that's what made me feel like you could tell the diuretics ain't working. Cause
Yeah.
it's like you.
Well, I don't know what's going on with this person. I don't know if they've been getting treatment or what they've been doing. It's just pictures, right? So.
Yeah, it's just scary. To
Well, I was
me.
about to say, even if they did, what, if the diuretics are not working, there's nothing they
There
can
ain't
do.
nothing they can
You
do.
just pretty much look
You
like that all the time.
yes.
So,
The
I'm just a
compression-
messenger, guys.
I know. So the compression side, like
That helps. Yeah, I mean, they can help. I mean, Obviously, some things aren't going to work for everybody, but
yeah.
so I don't.
You're right. I know. I'm just saying. I be trying everything, but
Yeah.
I see people like that. I be
Yeah.
like, man, they legs.
Some people also just aren't good about staying on top of their health either.
Yeah.
You know, some people just kind of like let themselves go and
Yeah.
they don't do anything.
Yeah.
So
yeah.
there's also that.
Yeah. You're right.
All right, next thing we got is lymphoma. You probably learned from Kelly's class, OMA. Whenever you see OMA, that's cancer, right? So lymphoma is cancer of what?
The lymph.
Right, the lymphatic system. So, cancer of the lymphatic system, etiology, it's like, well, why does any cancer happen, right? People just get cancer.
Right.
Any type of previous radiation. It's funny because they use radiation to treat cancer, but radiation is also a risk factor for developing cancer.
Yeah.
So it's okay. So symptoms, you have enlarged lymph nodes. So, like my aunt actually had this. I was really young, so I don't really remember her. But she had, there's two types. There's Hodgkin's lymphoma, and then there's also non-Hodgkin's lymphoma. I'm just going to really talk about Hodgkin's. Non-Hodgkin's is the much more deadly type. She had it, and she passed away. Like I said, I don't really remember her. She was only 38 though when she died. So that's really young, right? And she was healthy. So it wasn't like she wasn't like a smoker or drinker. She wasn't overweight. She was just normal. She developed this. Her first thing she noticed was like very enlarged lymph nodes, right? Because they're just swelling up with, because they're cancerous. A lot of fatigue, pruritus. Remember what pruritus is? What that means from integumentary?
Is that itchy?
Yep, good job. That's itching. Night sweats, weight loss, and again, like I said, weight loss is going to go with every type of cancer. Okay. So if someone comes in with complaints of lymph node swelling, especially if they're not sick, like it's normal for your lymph nodes to get swollen when you're sick, especially if you have like a sore throat or like a cold. The lymph nodes right here, like right under your chin, kind of like in your neck, those can get swollen. That's normal, right? Because you're sick. But this is like when you're not sick and you're healthy and they're just swollen all the time, and you're like, okay, what's going on, right? Does that make sense?
Yeah.
So they'll do a lymph node biopsy. Who knows what a biopsy is?
When they take a sample.
Yeah, they put a needle in there and suck out some of the tissues, and then they look at those tissues under a microscope and see if they're cancerous. So what's diagnostic for Hodgkin's lymphoma is the presence of what's called Reed-Sternberg cells. That is the hallmark way of diagnosing it, right? And this is what a Reed-Sternberg cell looks like. I think it looks kind of cute.
Oh, wow. Oh, my God.
It looks like cute little eyes to me.
Glasses.
It's sad because it's bad, obviously, because it's cancer, but he's just so adorable. So yeah, that's what a Reed-Sternberg cell looks like on the microscope.
Is that somebody?
Hmm?
Is that somebody? Is that a person?
This is just one of the cells from the biopsy.
No, I'm saying Reed
How did it
Sternberg.
sound?
Yeah.
Oh, the name?
Yeah.
Probably whoever discovered it. I don't know.
Oh, okay.
Yeah, I don't know. They name things after people who discover it. That's probably what it is. I don't know for sure.
Yeah.
Treatment, just like every cancer, radiation, chemo, some drugs, that's really all we got for cancer right now. Prognosis-wise, though, Hodgkin's lymphoma is very treatable. It can be cured. Non-Hodgkin's is going to be the more deadly version of this. So, yeah. The non-Hodgkin's don't have the Reed-Sternberg cells because it's it's just not, that's only diagnostic for the Hodgkin's. So I didn't really go into it too much just because I don't really need you guys to know the differences between all these different types of cancers. I just want you to be aware that there's Hodgkin's and non-Hodgkin's. Okay. All right, now we're done pretty much. Now we're just talking about medications, okay?
Oh, boy.
Yay. And again, I've done my absolute best to try and make this as simple as possible. It's just very difficult to do that with drugs. All right, so I have them split up into classes here. So, and these are interspersed in the PowerPoint slides themselves. So if you go back to hypertension, you'll see all of this again.
Right.
So beta blockers, ACE inhibitors, ARBs, and calcium channel blockers. These are all typically first-line treatments for hypertension. Okay, so there's lots of options for hypertension. Lots and lots of options. These are 4 different drug classes, and within each drug class, there's tons of other individual drugs, right? So we're looking at hundreds of different options of drugs for people to take. Okay, so beta blockers, how you remember that is they end in lol. Okay, LOL. So we got metoprolol, carvedilol, atenolol, propanolol. Those are all beta blockers, okay? And these help treat treat blood pressure, other heart conditions as well. But basically, if you see a medication like metoprolol, all I want you to be able to be that's related to blood pressure, probably other things with the heart as well. You don't need to know all the ins and outs of them, what they do, just be able to recognize that it's related to the heart, okay? Because if you're looking at a patient's chart and you're trying to, code their diagnoses, and you see that they're taking metoprolol, but they don't have any, heart conditions on their list, that should make you think, why there might be something missing. Does that make sense? Okay, ACE inhibitors, these also treat blood pressure. These end in pril. So lisinopril, enalapril, these are 2 examples. ARBs, these also treat blood pressure. These make your arteries dilate, so they help them to vasodilate better. And these end in sartan, telmisartan, valsartan, losartan, type of thing. It's nice when they follow the pattern, right, and they end all in the same thing to help them identify. Unfortunately, calcium channel blockers do not follow that rule because they have just different endings. These are the most common 3, so I put those there. These are the most common ones you'll see. Amlodipine, verapamil, diltiazem. These are also for blood pressure. They also help with heart rate and things like that. So these can be used for multiple different things, but blood pressure is usually the main one. Okay, so it's not just always for example, beta blockers can be used not just for blood pressure, but other heart-related conditions. But just being able to recognize that it's related to the circulatory system. Okay. Okay, we already know about diuretics, right? Causing you to urinate out excess water helps lower your blood pressure, right? Because if you get rid of more fluid, that's going to drop your pressure. It also can help get rid of swelling, right? With the edema, the lymphedema, all those things. It also just helps reduce the workload of your heart. So people with heart failure, the issue is that it can't pump properly anymore because the heart is damaged, right? So if you have less fluid for it to pump, it kind of gives the heart a break. It doesn't have to pump as much fluid. Does that make sense? The pump's job is to pump fluid, so if there's a ton of fluid, it has to work harder. If there's less fluid, it doesn't have to work as hard. So people with heart failure often are given diuretics to help give their heart a little bit of a break, And there's a bunch of different diuretics, so many, but these are very common ones. Furosemide is probably the most common. You might have heard it. It's called Lasix. Lasix is very common. Spironolactone and hydrochlorothiazide.
Yeah, that one. Hydrochlorothiazide.
You might see it as HCTZ. It's kind of like the abbreviation. Hydro, H, chloro, C, T for thiazide, and the Z. So HCTZ is often written down instead of that whole word. Any questions about this slide? Yeah, I know, they're long names. Any questions about those? Okay. Then we got this one. We talked about statins. These are the cholesterol lowering medications, right? They end in statin, so that's easy. Simvastatin, rosuvastatin, atorvastatin, for example. There's more, but you can be able to recognize them because they end in statin, okay? We talked about the anticoagulants and thrombolytics already. Anticoagulants prevent clots, right? So there's warfarin. Aspirin is technically considered an anticoagulant. Heparin, Lovenox. There's so many different types, guys, but these are the very common ones, the ones that you should be able to recognize. And then thrombolytics, these are ones that actually deal with a clot that's currently there. So they will actually help break it up. And these end in place. So alteplase, this is the most common one they use in the emergency room, or they might call it TPA. Retiplase, streptokinase, they get rid of a clot that you have already. Okay. We talked about nitroglycerin. That's a nitrate. These relieve chest pain by causing the vasodilation. So they rapidly cause those coronary arteries to open up, okay, and prevent and to allow more blood flow. And then we've got the antiarrhythmic drugs. I couldn't even begin to list them all because there's just so many, and it depends on what kind of arrhythmia you have. And we talked about the arrhythmias. There's different types of arrhythmias, and depending on what kind of arrhythmia you have, you're going to have a different drug. But basically, a lot of it has to do with levels of potassium, sodium, and calcium, interestingly. So people who typically have too much potassium will have one type of arrhythmia, or too much calcium will have a different type of arrhythmia. So a lot of the drugs that people give are meant to block certain calcium channel blockers or potassium blockers to help prevent those arrhythmias. So your electrolytes matter a lot. So when you get dehydrated and you don't have drink a Gatorade because you can have heart arrhythmias and things like that. So if you see things like sodium channel blockers or calcium channel blockers, that's what that's referring to, is usually to help prevent arrhythmias in the heart. I didn't want to get into all the different types of drugs because that's just way too much. But these are very, very common ones. Amiodarone, I think, is the most common drug given for arrhythmias. Then procainamide, lidocaine, these are also very common.
Lidocaine?
I know it sounds like the
Not the patch.
yeah, it's like for the numbing of your teeth.
Yeah.
I know. It has lots of different uses. It's very confusing.
So how would they give it? It's a pill?
Yeah, they have things in pill and IV form and things like that. So we've talked about how drugs have often more than one use, so it can be confusing. I'm just trying to give like the most common uses for stuff, because this isn't a pharmacology class. Like we don't need to go super in depth and everything. What my goal is for you to like see a drug and then have an idea what it is. So if you were to see clopidogrel on a patient's chart, you're like, oh, I know this is for clotting, right? This is a blood thinner, right? That type of thing. And that way it can help support a diagnosis that someone has, right? So like someone's got a DVT and they're on clopidogrel, that helps back that up. Does that make sense? And again, otherwise too, if someone's on a medication and you can't see any justification for it, it might be because they forgot to code in that diagnosis. Then you can ask for a clarification like, hey, does this person have heart disorders? I see they're taking metoprolol, but I don't see any heart diagnoses on their chart. Does that make sense? That makes you a really good coder because you get more money for more diagnoses, right? And if someone just forgot to put in one, and you're like, hey, I see they're taking this medication, but nothing to back it up, that's where you're earning your company money, like makes you valuable. Does that make sense? And that is pretty much it. That's the last slide. So hopefully that's not too painful as far as medications go. I will turn this off. Any questions before I turn it off?
Hold on, wait.
She's
Oh.
like, wait a minute.
Okay, go down again one more time.
That's it. That was the last
Oh,
slide.
okay, okay. I thought there was somebody for grandpa.